I'm Dr. Beth Case. I'm a provider here at the Collins Family Practice Clinic. I'm double board certified in internal medicine and pediatrics. So hypertension is more commonly known as high blood pressure. So in your body you have arteries, and they take your blood from your heart to the rest of your body, and that's the way your body carries oxygen. So when you go to a clinic, they usually give you two numbers. So the top number, which we like to be less than 120, is the pressure in those arteries when your heart squeezes. And then the bottom number, which we like less than 80, is the pressure in those arteries when your heart relaxes. A lot of different things really, but diet's a big one. It runs in families, and you can do all the right things and still get it. And sometimes it can be not being really stressed, not getting enough sleep. All those are important too. And also being overweight can be a risk factor as well. If the heart's having to pump against a high pressure, that's a lot of stress over time, which can lead to heart attacks. If the pressure's really high getting to the brain, sometimes the blood doesn't get there, you get strokes. Sometimes it happens in the kidneys, you get kidney failure, which can lead to long-term issues like dialysis. And then a big one that we're kind of doing, more research in is dementia. So over time, that high blood pressure just can cause damage to the brain as well. Not just strokes, but also memory. What's the problem about blood pressure is it's kind of, you hear it, the silent disease. So it's up and you're used to it being up, so you don't even notice it for a long time. And at that point, a lot of times it's already done some damage. But the good news about it is it is treatable. Now, if it gets so high you're having headaches, chest pain, trouble breathing, things like that, definitely need to see your provider. But I always tell people to keep a check on it. You can go to a lot of pharmacies or grocery stores sometimes and they can check it with the monitor. And like I said, our numbers, we want them to be around 120 over 80. So lifestyle can make a big difference. So even watching the salt in the diet, you can also go online. It's called the DASH diet, and you can get a lot of resources from there about certain foods to eat. And then exercising, getting the heart rate up, working the body can help as well. It also helps with stress levels when you exercise. And then sometimes we end up having to use medicine, and that's okay. Like I said, overall it's better to have it under control so that you help the rest of the body recover.